Fourth in the series of OTC Spanish translations. A couple of these are, we've got 4 medications that are over the counter, or at least without prescription, for various antimicrobial issues, antibacterial, antifungal, antiviral. So let's start with Neosporin. Bacitracin, neomycin, polymyxin B becomes bacitracina, neomycina, and polymyxina B. So bacitracina, neomycina, polymyxina B. Number 1 is bacitracin zinc, bacitracina zinc, bacitracina zinc. 2 is neomycin sulfate. It has that mycin stem, but again, the mycin doesn't really tell you anything. It just tells you it comes from the Streptomyces bacteria. So sulfato de neomycina, sulfato de neomycina. La raíz es mycina, so the stem is mycina. 3, polymyxin B sulfate, sulfato de polymyxina B, sulfato de polymyxina B, polymyxin B sulfate. And it actually seems like it works. My mnemonic for neosporin, or assembling neosporin, so you can assemble it from the parts of the Spanish word. So neo y sulfato y el P y O y el R y and N. All of those come together to make neosporin in Spanish or English. Next drug is going to be Lotrimin Ultra. It's an antifungal. Butenafine. So it just becomes, again, we change the E to an A, Butenafina. And it's an antifungico. Terbinafine. There's no nafine stem. I was a little bit surprised like that because there's other drugs that end with that nafine, but I didn't see it as a stem on the United States Adopted Names Council list. But terbinafina, and then nafina no es la raíz. And then 3, Lotrimin Ultra and Lotrimin. These are a little bit different. Lotrimin Ultra is butenafina or butenafine, and then Lotrimin is clotrimazole. So Lotrimin Ultra y Lotrimin. Docosanol, Abreva. This is awesome because it's spelled the exact same way, because when you do the pronunciation, it's Docosanol. And that's usually how Spanish words work. You have a vowel, and end with that consonant. So Docosanol. And it's an acute antiviral, so antiviral. Docosanol in the ball. You can sort of work this in, but Docosanol y el baile. Docosanol y el baile, so the dance that someone would go to. And those don't exactly rhyme in Spanish, so maybe my mnemonic does fall apart. And then abbreviates the cold sore. What's it for? Abrevia la duración del herpes labial. Abrevia la duración del herpes labial. Okay. All right, let's go on to influenza. So Influenza Virus Vaccine becomes Vacuna del Virus de la Gripe. Influenza. So Influenza Virus Vaccine, or Fluzone, becomes Vacuna del Virus de la Gripe. Influenza. There's a prophylactic vaccine, so Vacuna prophylactico. Vacuna prophylactica. Something that's works ahead of time to prevent an illness. So it's OTC, sort of. No es realmente de venta libre. No es realmente de venta libre, pero sí sin prescripción médica. No es realmente de venta libre, pero sí sin prescripción médica. So what we're saying is, it's really not OTC, but it is non-prescription, certainly for most adults. Flu in brand names, so Tamiflu. Flu en nombres comerciales, so commercial names. For example, por ejemplo is what PEJ stands for, Tamiflu. And then flu in generic names, por ejemplo, fluoxetine, becomes fluoxetina, but remind you that fluorine is the reason that FLU is in fluoxetine, and influenza is the reason that flu is in Tamiflu. But flu en nombres genéricos, por ejemplo, fluoxetina. Flu en nombres genéricos, por ejemplo, fluoxetina. Benzocaine is ambisol, so benzocaína. Benzocaine is ambisol, so benzocaína. It's an anesthetic, anestésico, 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 anestésico. Yep. Dermatologic versus injectable. Dermatológico, y inyectable. No, that's not right. So dermatológico y inyectable. Inyectable. Yeah. And then the stem is cane. So la raíz es caína. La raíz es caína. So you might know it from cocaína, which is cocaine. Cocaine was one of the original anesthetics. So cocaína would have been uno de las originales anestésicos. Lidocaine is solar cane, so lidocaína, and again it's an anesthetic, so anestésico, and it's dermatologic versus injectable, so dermatológico versus inyectable. So dermatológico y inyectable, and the stem is cane, la raíz es caína. La raíz es caína. Meclizine is Dramamine, just becomes that again, that E to A, meclicina, antihistamínico, and mareos is motion sickness. So antihistamínico para mareos, motion sickness. The ene in the brand name in amine, that ene doesn't tell you anything about its drug class. An amine is just a group with a nitrogen in it. INA, or INA, and then nombre comercial y amina, and we're just saying that the I, the N, the A don't tell you anything about it. And then dizzy doesn't really work to make it mareado. So if you think of mare is like an ocean, so it's oceaned, where somebody, how they would feel on the ocean, literally, if you're changing the Spanish to English. So my dizzy and izzy falls apart with that particular mnemonic. Acetaminophen with diphenhydramine, Tylenol PM, acetaminophenol, and diphenhydramina, so acetaminophenol and diphenhydramina. It's a non-narcotic analgesic, so analgésico no opioide. Analgésico no opioide. And we've talked about Tylenol before, and it's for the pain that sometimes maybe somebody's trying to go to sleep and they can't because it's some kind of pain. And then we have an H1 antihistamine, first generation, so antagonista H1 con antihistamínico de primera generación. Antagonista H1 con antihistamínico de primera generación. So first generation antihistamine is sedating, it just reminds us of that. And then the pain plus insomnia, that's what it's for, so dolor y insomnio. And the reason why PM and post-meridian probably, it's Latin, so Spanish is a Latinate language. So post-meridium really means horas posteriores al mediodía, hace referencia a la noche. So the hours after the middle of the day references really nighttime. So horas posteriores al mediodía hace referencia a la noche. Omega-3 fatty acids, which is fish oil, or you can find out which fish oil, ácidos grasos omega-3, aceite de pescado. Again, we reverse that to make it oil of fish. Right? It's an essential fat, so ácido graso esencial. It's worked into the cell membrane, so membranas celulares, and it's regarding heart disease. So this really is cardiopathology, but heart disease, cardiopathology, cardiopatia is the translation. Okay, so another one of the cardiac drugs, nicotinic acid, which is niacin, ácido nicotínico, niacina. So ácido nicotínico, niacina. It's vitamin B3 or B3 and vitamina B3. Vitamina B3. It improves cholesterol, mejora el colesterol. Mejora el colesterol. And it causes the niacin flush and aspirin. So that flush in Spanish becomes, you become reddened. So the reddening because of the niacin. So the niacin flush is cured or prevented with aspirin 30 minutes before. El enrojecimiento por niacina y la aspirina. I'm just saying the reddening by niacin and treated by the aspirin. So el enrojecimiento por niacina y la aspirina que ayuda con ese enrojecimiento, and the aspirin that helps with that reddening or prevent that reddening. We see aspirin again because in a cardiac situation we're talking about thinning those platelets. So aspirin again is aspirina. We're talking about a non-steroidal anti-inflammatory, but not really used as an anti-inflammatory. We're using it for the effect on the platelets. So again, it's non-steroidal anti-inflammatory drug. This is 81 milligrams, not 325. So anti-inflamatorio, no esteroideo. Anti-inflamatorio, no esteroideo. 81 miligramos versus 325 miligramos. So 81 miligramos and 325 miligramos. Efectos sobre las plaquetas. Efectos sobre las plaquetas, so effect on platelets. And you see 365 tablets, looks the same, but you would pronounce it 365 tabletas. So 365 tablets. Why? Because that's how many days there are in a year or a non-leap year. Regular insulin, Humulin R, insulina normal. Insulina normal, so regular. That can actually be problematic because the normal becomes an N, and we'll see NPH as the next insulin. And you can also see it maybe as insulina de acción rápida. Insulina de acción rápida. But the Humalog is one that really is rapid, so the translation may be not as good as I'd like. And then in order, the fastest is Humalog, then R, or the insulina normal, and then the N, and then the Lantus in terms of how quickly it happens. And then it's OTC, de venta libre. It's not really, you have to go to the pharmacy to get it, but don't need a prescription certainly. Sin receta. NPH insulin, Humulin N, is insulina NPH. Insulina NPH. It's an intermediate acting insulin, so insulina NPH, insulina de acción intermedia. Insulina NPH is insulina de acción intermedia. Humalog, RN, and Lantus, again, the order, how quick they work. And then OTC, de venta libre. Again, we have to go behind the counter probably to talk to the pharmacist to get it. Necesita pedir el farmacéutico para la insulina porque está en el refrigerador. You have to ask the pharmacist because it's in the refrigerator. Levonorgestrel, Plan B, one step. I think this is the same both ways. Levonorgestrel. And Plan B is Plan B. ¿Cuál es el Plan A? Would just be a translation. Un único paso, solo una pastilla. It was one step. It is one step because there used to be a two-step. Es único paso, solo una pastilla. And then the stem is just. La raíz is just. So I don't know how helpful this was, but if you do run across Spanish-speaking patients, it seems like talking with generic names is going to be a better way to communicate things that are very similar. And what will usually happen is if you just say the word in English, like aspirin, they may just talk back and say aspirina. And you'll say, oh yeah, so you're used to adding that A, or you're used to changing the E to an A, or you're used to seeing the E on the end drop to keep the L there, or something like that. So again, hopefully this was helpful, and I will see you soon.